Hi, my name's Alexa. I'm going to go ahead and perform a head, neck, and regional lymphatic assessment on you. If you can confirm your name and your date of birth for me.
Anissa Ramos, 8/15/2002.
Okay, good. I'm going to go ahead and start by collecting some past history. Have you had any head injuries lately?
No.
Are you currently experiencing any headaches?
No.
Dizziness?
No.
Neck pain?
No.
Have you had any cranial or neck surgery?
No.
No. And are you currently on any medications?
No.
Any lumps or bumps that you're worried about?
No.
Okay, and if I can have your age,
20,
your weight,
138 pounds,
your height,
5'2".
and do you have any allergies?
No.
Okay, I'm going to start by inspecting your face, making sure your eyebrows are symmetrical, which they are, your eyes, making sure there's no exophthalmos, and there's not. Color looks fine, there's no swelling. I'm going to check if there's any drooping of the face, which there's not. Making sure your lips are symmetrical, making sure there's no ridges or bumps or lumps, and there's not. Now I'm going to go to the neck, making sure there's no red streaks or swelling, and there's none that I can see. Making sure your trachea is midline, so if I can have you look straight for me, it looks midline. Any involuntary tics with your face or neck, and there's not any. And assess your range of motion, so if you can look up and down, side to side, and then forward and backward. Good. And then if I can have you take a sip of water, I'm gonna assess your swallowing.
Thank you.
Good. Okay, and then for your glands, I'm gonna assess some swelling in the parietal or salivary glands, and there's not any. And if you can go ahead and open your mouth, I'm gonna assess it for any swelling. There's none. Okay, I'm gonna start my palpitations. I'm gonna start with your head. And I'm just gonna assess for any ridges or and then movement of your scalp. So let me know if there's any tenderness or pain. Everything seems to be symmetrical. And your head size is normal to your body size. Okay, and I'm gonna go ahead and palpate your temporal artery, if that's okay. Okay, and that's good. And I'm gonna go ahead and palpate your carotid artery. Good. Okay, I'm gonna go ahead and palpate your temporal mandibulary joint. So if I can have you open your mouth and close, and this is just checking for any popping or a tenderness or pain. Did you have any pain doing that?
No.
Okay, good. And if I can have you open your mouth with resistance. Good. Okay, I'm gonna go ahead and palpate your lymph nodes. I'm gonna look for mobility, temperature. So I'm gonna start with your preauricular, which is in front of your ears. I'm just gonna go in a circular motion. Tell me if you feel any pain or tenderness. Okay, I'm gonna go ahead and go to the post-auricular. Any pain or tenderness?
No.
Okay, I'm gonna go to the occipital. Pain or tenderness?
No.
Okay, and I'm gonna go to this submental, and then your submandibular, and then I'm gonna go ahead and do your tonsils. Any pain or tenderness?
No.
Okay, and I'm gonna go ahead and do your posterior cervical chain, which is down through here. Any pain?
No.
And then your supraclavicular. Any pain?
No.
Okay, good. So I'm gonna go ahead and palpate your thyroid. So if you can go ahead and sit and look towards the wall for me. Okay, I'm gonna palpate from the back, so I'm gonna feel for your Adam's apple and move my fingers down. I'm gonna palpate, and if you can go ahead and swallow for me. Good, and that's just assessing to see if one side was higher than the other, and none were. So I'm gonna go ahead and push your thyroid to your right and palpate. And now to your left and palpate. Good. Okay, and if I can have you sit back down, facing towards me, and I'm gonna go ahead and auscultate your thyroid to check for any bruit. Okay, sounds normal. It sounds normal as well. Good. Okay, I'm gonna go ahead and assess your cranial nerves. So I'm gonna go ahead and do 9 and 10. So this one is with your swallowing, and I'm assessing for any difficulty swallowing, speaking, or slurring of words, which from what you have told me and what I've heard, there's no slurring of words. So I'm gonna go ahead and ask you to open your mouth and say ah. And this is just to check that your uvula is midline, and it is. I'm gonna do cranial nerve 7, which is just drooping, and there's none. Your face seems symmetrical. So I'm gonna go ahead and ask you to close your eyes really tight and then open them. Good, and then smile, frown, and puff out your cheeks. And I'm gonna go ahead and squish to see if you can hold the bubble, and you can. So that's good. Can you whistle? Good. Okay, I'm gonna go ahead and do cranial nerve 5. This one, can you go ahead and just clench your teeth? Clenching. Okay, and I'm gonna assess the temporal. Any tenderness?
No.
Okay, and if you can go ahead and open your mouth, I'm gonna do resistance. Good. Okay, and then can you do side to side? And then resistance. Good. Okay, up and then down. Good. And then cranial nerve 11. If you can shrug your shoulders up and down, and then with resistance. Okay, and then turn your head side to side again. Good. Okay. So that concludes our head, face, and regional lymphatic assessment.